So I'm Caroline Brereton. I'm the CEO at the Mississagua-Halton Community Care Access Centre, and my organisation provides care to those who need support in the community. We help place patients into long-term care. We help patients move from hospital to home to finish their recovery at home. And we support children in the school, whether it's children with physical disabilities, physical challenges, or mental health and addiction challenges.
Okay, excellent. And so in your opinion, what are the three main challenges facing an improvement to patient experience?
As I was mentioning in my session, I think one of the really big ones is helping people understand what their journey through the healthcare system will look like. So preparing them for the next step and understanding what it means for them to take that next step. So I would say that's one of the important ones. I think the second one is to understand how we can introduce and leverage technology to help them feel more in control of their journey and be a part of that journey, be actively engaged in the journey. And I think while technology is very prominent in healthcare in terms of planning for your next stage in your healthcare journey, self-care, we've not done as good a job as we could in terms of the use of technology. And I think the third challenge would be understanding the diversity of the populations that we serve. We often apply a broad lens to our planning in terms of this will work for everyone, and we have to, I think, be able to customize our programs and our approach more to meet the diverse needs of our population.
Well, definitely, I agree. And to build on that, where would you say your organization is at in terms of implementing an actual patient experience model? Are you guys more towards the entry stage, or have you already fully implemented and you're coming to this event to look to improve what you already have?
Certainly we're in the implementation phase. In the past year we introduced a new model for support for patients, and that model is based on understanding what subsets of our overall population need. So we have restructured how we deliver our care so that there is more integration of the care team and there is more support for the more complex patients. So that means we will get to interact with the patient more. We will be in a better position to be a quarterback for that patient. And we know that from a patient experience, the patients are looking for somebody who will be there with them along the journey, helping them to navigate the system. So we've reorganized our teams to be able to do that. The next phase is around implementing standards of care that are focused on enhancing the patient experience. And so it was helpful to hear speakers talk about what they're doing and how they're approaching it. And I guess for me what stood out is that it's very much about listening to our patients and their families and hearing what's important to them and being as nimble as we can. Part of being nimble is helping patients understand what they can expect from the system. If we don't help them understand what they can expect, any change is a real surprise then. But when we can frame the change in terms of what's happening within the context of what they expected, I think that makes it much easier.
Excellent. And so what would you say that you got out of the conference for these past 2 days?
I was really impressed with the diversity of the attendees at the conference, which confirms for me that we're all interested in making a difference in the patient experience, and we're all working on similar things. And for me, what I heard is very much working with our partners within our organizations. Observation might be we still need to do a little bit more work working across the continuum of care.
Perfect. Thank you so much, Caroline.
Oh, you're welcome.